Some commonly used drugs can interfere with kidney function, possibly leading to kidney failure. We spoke with Dr. Rodolfo Batarse at Desert Regional Medical Center, who explains what kidney failure is and how some medications can affect renal function.
Kidney failure is a condition where the kidney, the normal physiologic function of the kidney is compromised, meaning that the kidneys cannot do their jobs appropriately. It gets damaged by some insult, whether it be a disease, a genetic condition, trauma, sometimes medications as a side effect, and the function slowly deteriorates over time. And if that is not taken care of, then it could lead to complete failure.
We ask why some medications harm your kidneys.
A lot of the medications that are over the counter, pain medications, what we call analgesics, common over-the-counter medications, Advil, ketoprofen, ibuprofen, Indocin, indomethacin, all these types of medications have the side effect that if taken for prolonged periods of time, even in small doses, or at high doses for a long enough period of time, they can damage the kidney. That is direct toxic effect to the kidney cells and to the kidney tubules, which are part of the kidney that control electrolytes and concentration and the urine production and the like. Now that is one thing that is a function of both the quantity of medication that you take and the length with which you take it. So we have lots of very good medications. As a matter of fact, for blood pressure, the #2 reason in the US why people have kidney injury and kidney damage, there are over 300 medications that we can choose from as physicians currently in the United States. One of those classes is what we call ACE inhibitors. Ramipril is one of the medications that fall under that class. Medications are fantastic and they're indicated for a lot of different comorbidities or a lot of different medical conditions. When these medications are prescribed, it is so common and indicated that a number of days after the medication is prescribed, new blood tests are drawn to see the reaction and the effects of the medication on the kidney. Sometimes, if the medication is begun and labs are checked sometime later, a few weeks later, let's say, and we notice a decline in kidney function and that medication is stopped, oftentimes if we catch it early enough, then no permanent damage is done. The vascular effects, the transient effects of these medications will wear off and then the kidney function will return back to normal.
We asked Dr. Batarse about the risk and the benefits of medications.
The risk and benefit ratio of every medication to each specific patient needs to be considered. Because if this medication, for instance, if someone has high blood pressure and they have diabetes and they have a lot of protein in their urine, which is a marker of kidney damage in diabetes, and this medication has been shown to not only control blood pressure, but also decrease the amount of protein in the urine and decrease the progression of the kidney injury, then as a physician and as a patient, we should discuss it and say, listen, I understand that at least in the short term, your kidneys are a little bit worse. But over the long term, the research has shown that it will help you. And that's where education and discussion happens, and we make an educated and combined decision.